scapula. If they're tight, then it's likely you're going to see a superior clavicle. If they're not tight, then it's likely you'll see a depressed clavicle. It is so variable, this. I'd say if you find a AC joint jam with shoulder pain, hit it anyway. It's just too variable to really get the good grips with the theory on this. And it is a floating bone. Basically, it isn't under good control from muscle. The whole purpose of the clavicle is to spread your chest. Yeah, and it's for climbing animals. So you can get your arms out like that to climb with. So most mammals actually don't have a clavicle. For exactly that reason. Cats are interesting because they do have a clavicle, but it's not attached to either end. Or rather it is, but it's sort of a cartilaginous attachment. There's no bony joint attachment. But it's so that they can still spread their arms, and when they jump down on their paws, they don't fracture anything. So if we're looking at the spine causing a clavicular an AC joint problem, it's going to be an inability to extend, isn't it? So either the first, second ribs are not going to be able to come up and back, or the facets are not going to be able to extend back in that sense. What about the shoulder or AC joint producing a thoracic problem? What are you going to see in the thorax? Because you have to make this determination, don't you? Well, you don't actually have to, because you can treat it the same way. But basically, if I've got a patient coming in with pain over the AC joint or the shoulder, and I'm thinking the thorax is causing that, we're looking for basically an inability to extend on that side, aren't we? On the other end, if I've got a patient coming with thoracic pain, I'm looking at the shoulder causing thoracic pain. What am I expecting to see in the shoulder?
Shoulder.
Sorry, what am I expecting to see in the thorax, not shoulder?
Flexion. Subluxation.
What direction?
On the ipsilateral side.
Yeah. What direction?
Anyone.
What is it? Flexion or extension? Subluxation.
Flexion.
Why?
Because you're not able to fully extend. Oh.
That'll bugger up the shoulder.
Right.
We talk about the shoulder buggering up the thorax.
I was going to say it's extension, hyper.
Or jam into extension.
Yeah, hypermobility.
Yeah. No. Not an extension of hypermobility. Hypermobility or a subluxation.
Right.
When? Because if I can't get the movement in the shoulder, I'm going to overdo the thoracic one. And this is the type of thing you see all the time. I get a medial elbow pain. Okay, in a throwing athlete. Where will I look? There you go. List of places you'd look for let's say, a medial collateral grade 2 instability. All right, the ligament's been stretched out. Where will I look to find the cause of this? Throwing's not good enough.
Medial elbow pain.
It's an ulnar collateral ligament instability. So yeah, they've got medial elbow pain.
Shoulders, scapula, T-spine.
Okay, so what am I going to find each? Write it out.